In this video, we'll demonstrate a localization training protocol. This can be used as part of sensory discrimination training to drive cortical changes in patients with persistent low back pain. Begin by marking a numbered grid of approximately 9 points on the patient's low back. Give the patient a picture depicting the numbered grid to use during testing. From here, randomly stimulate one of the points using a blunt object such as a cork or pencil eraser. The patient should verbalize the point they think you touched. For incorrect guesses, provide corrective feedback to the patient. There are a couple ways we can modify the task difficulty. We can increase or decrease the distance between grid points, or increase or decrease the number of points on the grid. We can begin to introduce different types of stimuli. For example, we might vary between a pen cap and a cork. The patient would then have to discriminate between location of stimulus and type of stimulus. We might also try testing in different positions, prone, sitting, or standing. During training, try to notice, are there any areas across the low back where the patient has particular difficulty? For example, in a study by Wand et al. In 2010, authors reported that sensory discrimination ability seemed to be most compromised in the patient's area of greatest pain. In this case, it may make sense to focus the training effort in this area. During training, aim for a success rate of about 80%. If the patient's success rate falls below 60%, consider decreasing the task difficulty. And if the patient's success rate rises above 90%, consider increasing the task difficulty. Most studies have used the training dosage of 3 sets by 30 to 60 stimuli with rest between sets with daily training for a period of 2 to 3 weeks, but optimal training dosage has yet to be established.